So you're facing a knee replacement, or maybe someone you love is. That first month after surgery, well, it can feel like this huge, scary unknown, right? In this explainer, we're going to pull back the curtain. We'll look at the official medical plan, and then we'll get into the real-life, day-to-day experience of what it's really like.
And that's the big question we're tackling today. You can read all the pamphlets and listen to the doctor's instructions, but what does that first month of recovery actually feel like? We're going to explore that gap, the space between the plan on paper and the reality on the ground.
All right, here's our game plan. We'll start with the official roadmap from the doctors. Then, we'll zoom way in on that super critical first week. After that, we get personal with a patient's private log, before seeing how the plan and reality, sometimes clash. And finally, we'll talk about what all this means for your unique path to recovery.
Okay, first up, the first month roadmap. Think of this as your foundation. It's the medically approved guide, the step-by-step instructions designed to get you from surgery to recovery as safely and as quickly as possible.
Now, at the very heart of this roadmap is your pain management plan. And listen, this is way more than just taking pills. It's a whole coordinated strategy. It's this toolkit that combines your meds, physical therapy, and some really key self-care stuff. This is basically your playbook for the first 4 weeks.
What I love about this timeline is how it clearly lays out your priorities. See, week 1 is all about playing defense, just managing that pain and swelling. Then you pivot to offense. In week 2, you start pushing your mobility. And by weeks 3 and 4, you're really focused on building back your strength and getting back to your normal life. It's a very logical progression.
Okay, so let's really zero in on that first week. This is, without a doubt, the most intense part of your recovery. The things you do right here, in these first few days, will have the biggest impact on the whole month.
And let's focus on just one number for a second, 72. Those first 72 hours, that's 3 days, that is your absolute prime window to get a handle on the swelling. If you can control the inflammation right from the get-go, you're setting yourself up for a much smoother recovery.
So how do you do it? This slide lays it out perfectly. It's kind of the holy trinity of swelling management. It's not just about slapping an ice pack on your knee. No, you have to elevate your leg, get it up above your heart so gravity can help you out. Then, that compression wrap gives you some gentle, constant pressure. And finally, you have to be consistent with the ice. 20 minutes on, about 40 minutes off.
And of course, medication is a huge piece of the puzzle. You'll probably have a whole toolkit of different things. You've got opioids for that initial really intense pain, and NSAIDs like ibuprofen are there to fight the inflammation. You might even have some nerve pain agents. And we can't forget the unsung hero of recovery, stool softeners. Trust me, they are absolutely essential for dealing with the side effects of those opioids.
Okay, so that was the clinical guide, the official plan. But now we're going to do a complete 180. Let's look at the unwritten side of recovery, the personal, emotional, day-to-day stuff told through a real patient's private log.
This entry from day 3, wow, it just gets right to the heart of it. That phrase, stay ahead of the pain, is something every single patient hears. But when you are in it, when it feels like this constant, heavy fog, that advice can feel impossible. It's a real battle. And yeah, some moments, it absolutely feels like you're losing. And then you get this gem from day 9. I love this quote because it perfectly captures the messy, complicated feelings of recovery. That ice pack is your best friend because it brings relief, but it also keeps you tethered to the couch on a schedule. It feels like a prison sometimes. It's this total love-hate relationship with the very things that are making you better. So the biggest takeaway from this personal log is simple, but it's so important. Healing isn't just about your bones and muscles knitting themselves back together. It is an emotional marathon. It takes a ton of patience, a ton of resilience, and honestly, a lot of kindness toward yourself.
So, where does that leave us? Let's try to bring these two worlds together. This next section is all about what happens when the plan meets reality. This is where we bridge that gap between the neat, clean guide and the messy, personal journey.
And this, right here, just nails that disconnect. The guide says pain will gradually decrease, but the reality? Progress isn't a straight line. You're going to have good days and bad days. The guide says begin gentle physical therapy. The patient's log calls the therapist a saint with a torture license. And isn't that perfect? You know they're helping you, but man, it hurts. And my favorite? Get adequate rest. Yeah, right. It's more like a treasure hunt for 5 minutes of sleep when you can't get comfortable.
This chart does a great job of showing the fundamental trade-off you're making during recovery. You can see your mobility,
that's the green bar, is hopefully steadily increasing week after week. But look at the pain level. It actually might spike when you start new exercises, but the overall goal, the trend, is for it to go down over time. Everything you're doing is in service of this trade. A little more pain now for a lot more mobility later.
All right, let's pull all of this together into some actual advice you can use. Our final section, your recovery, your path. These are the absolute key takeaways for anyone about to start this journey.
So, what do you really need to remember? First, follow that clinical plan. It's your map for a reason, so stick to it. But just as important, you have to listen to your body. It knows when to push and when you need to back off. Be patient with yourself. Healing takes its own sweet time. And please, celebrate the small victories. Getting to the mailbox, sleeping for 3 hours straight, those are huge wins. And above all, remember that while the plan might be generic, your journey is anything but. It is uniquely yours.
Ultimately, it comes down to this. You now have the clinical roadmap and you've seen a glimpse of the unwritten personal side. The plan gives you the structure, but you are the one who has to live the experience. So the real question is, knowing all of this, how are you going to write your own recovery story?